All right, well, you know, bloating can make people uncomfortable, but when it comes to dogs, it can actually be a life-threatening condition. We have Dr. Sunil Vasanjay and Lisa Williams from the Heart of Texas Veterinary Specialty Center to talk more. Thank you guys for coming in.
Thank you.
And bringing Gunner here, 3-year-old German Shepherd. He's doing so well, just hanging out. So tell me a little bit about what this condition is. What is bloating?
So bloating is pretty much where the stomach fills up with either gas, fluid, or food. But where it becomes life-threatening is when that stomach actually twists on itself. And then what happens is the blood supply to the stomach and certain other organs in the abdomen is cut off. And that's when it becomes life-threatening.
Because you don't, I guess, you know, people get bloating all the time and don't think about this, but it's something that can actually happen to your dog?
Correct, yeah. And that's, I mean, it's a problem when that stomach twists on itself, because like you said, bloat really doesn't cause any major issues, just maybe an upset tummy. But when it twists on itself, that's when it becomes a very serious condition, a very emergent condition, and you need to rush your pet to a closest veterinary hospital if you notice any signs.
So I mean, for the dog owners that are watching, what are some of the symptoms we can look for? I mean, how would we even know that that's happening?
So there are certain breeds that will typically see this condition developing, mostly large and giant breed dogs. Gunner is one example. Other dogs would be Great Danes, standard poodles, Weimaraners, Irish setters. So most owners, if you have a dog that's at risk, then there's certain things you need to look out for. One thing is something called non-productive vomiting, where your dog will try to throw up but nothing comes out.
Oh, okay.
You may notice drooling. And the most striking thing that most owners will notice is the abdomen becomes severely distended within a very short period of time. And if they notice any of those signs, they need to get their dog in the car and get to the nearest veterinary hospital.
Okay, wow, that can be kind of scary, I guess.
Yeah, and once at the veterinary hospital, then their pet will be stabilized and will then require emergency surgery.
And Gunner has actually been through the surgery.
Yeah, so Gunner did not have a gastric dilation and volvulus or bloat. He actually had eaten something. He was a little naughty and ate something he wasn't supposed to. And so we had done surgery on him, and so because he's a breed at risk of developing this condition, we did a prophylactic procedure so that he does not develop this in the future. And that procedure pretty much just involves stitching the stomach to the body wall so he does not twist in the future.
And he looks good now.
Yep.
He's healthy and ready to go. Just ready to take. He already had his morning walk, so he's just ready for his little afternoon nap. Is there any after the surgery? Is there any other treatment after that, or just something to just still keep an eye on for?
No. Once they have the surgery, it's just about a 2-week recovery time, and after that they can live happy, healthy, normal lives. Shouldn't have any issues from that condition. But yeah, they do well. Dogs that have the condition and have surgery have an at least 90% chance of surviving and doing well.
But if you have one of those dogs, it's definitely something to watch out for. Is there any preventative measures that the owner can take so that you don't even have to have them do surgery?
Yeah, so the only definitive preventative measure is the surgery that Hunter had. We call that a prophylactic gastropexy.
Okay.
But owners that have dogs that are at risk and can't have the surgery for whatever reason can try and avoid developing that condition by not feeding their dog one large meal per day, so splitting up meals into 2 or 3 meals per day. Smaller meals, yeah. Not exercising their dog vigorously after they've just eaten. For some weird reason, temperament plays a role. Dogs that are anxious or nervous tend to develop this condition, and so trying to modify their dog's temperament is also important.
Wow, good stuff. Thank you guys both for coming in. And so to learn more information, there's information there on your screen, and of course Gunner looks good to go, but the number 512-744-4644, and you can go to heartoftexasvets.com for more information. They're also on Facebook and Twitter. We got to keep our fur babies and ourselves healthy. All right, we'll be back after this.